The Grafton Way building is a fantastic building for the patients of North Central London and further afield. It's a 13-storey building, but a lot of it is below ground. From the bottom up, we've got the Proton Beam unit, one of two of the national Proton Beam service in the country, providing specialist radiotherapy treatment for children and adults. Then above that, we've got 8 operating theatres set up for patients who are coming in to have elective surgery. It's a fantastic place for day surgery, really efficient. On top of that, from the second floor up to the top, we've got one of Europe's largest blood cancer centres with 82 beds, supported by a 10-bed critical care unit on the first floor. We've also got an imaging centre. Patients walking in that building should expect world-class care, and they should receive world-class care.
Proton beam therapy is a form of radiation treatment. So radiotherapy, as we normally understand, is used with X-rays, and for many patients, X-ray treatment still remains an excellent choice. Proton beam therapy is different because protons have a particular property. They travel into the body, treat the tumour, but then any normal tissues that sits beyond the tumour is saved any exposure to radiation. This is particularly important in children and teenagers because many of them are still growing. And actually, if we could spare that normal tissue, it means that we can cure your cancer and your survivorship is better because you have less long-term effects from it.
We've got 4 treatment gantries at UCLH. Patients usually have about 5 or 6 weeks of proton beam therapy in total, and it's really, really important that we make sure that the patients are in exactly the same position every day for their treatment, and therefore we create bespoke immobilisation. So it can be something like a head shell, or it might be something called a vacuum-formed bag to ensure that the patients are in exactly the same position. Before, patients had to travel abroad. Bringing proton beam therapy to London means they can stay much, much closer to home.
When we were thinking about how to design it, we really wanted to put the patient experience at the centre of it.
We're fortunate to have had charitable funding, which has uplifted many of our areas.
If parents are relaxed, their children relax. And that means that when we're setting you up for proton beam therapy, it's easier and faster, and that means that treatment is more accurate. So all these little bits really add up to a better patient experience and better patient outcomes.
Here we see patients for surgery on their face and mouth, including dental work, also ear, nose and throat surgery and orthopaedic surgery. The typical patient we would see, first of all, in an outpatient setting, so that could be at the Royal National ENT and Eastman Dental Hospital or University College Hospital, which is literally a minute walk away either building. They then come here if suitable for their general anaesthetic.
Orthopaedic surgery is bone and joint surgery, and that covers every joint in the body. We run up to 5 orthopaedic theatres per day. We don't do any emergency work, and that allows us to improve the efficiency of the way we operate. Whilst a lot of patients will go home on the same day, and we aim to do that, there are other patients, particularly in orthopaedic surgery, who will need to stay overnight, and that's why we have the ward facility here as well. We've got a massive team, all of whom are dedicated and orthopaedic specialised. We've got access to the best techniques, to new technology, so we can give the patients what we think is the best chance of getting the optimal outcome from a surgical point of view.
I had the operation on Friday afternoon. My family are amazed at how quickly I'm coming out, really. I feel confident to go home now that things have been, all checked out, everything's in place. And I've had really good care, kind care. If I had a third hip, I would come back and have that done as well.
This morning I'm doing a stapes operation and a cochlear implant surgery to restore hearing. And we love as a team to be able to help people in that way. We take a number of referrals from other ENT departments, and that means that we have to be able to deal with a greater complexity of problems. Having a facility that's state-of-the-art is a big part of that.
On levels 2, 3 and 4 is where you would find the hematology patients. The majority of our work relates to malignant diseases, so blood cancers, leukemias, lymphoma and myeloma. We're lucky to have very strong links with our academic partners in UCL, so it helps us to carry out translational research. Our patients need very specific facilities, and it largely relates to protecting them against infection. So every patient is in a single room with their own ensuite facility. Our feedback from the patients is they appreciate they're coming to somewhere that's been specifically designed for them. But of course, a building is only a building, and the thing that makes it tick is the people.
Haematology nurses have very specialist competencies because we give such complex therapies, and with these skills comes a lot of responsibility. So we really have to be monitoring very closely and escalating as quickly as possible.
Grafton Way building, it's fantastic. Every time I walk in there, I feel uplifted. The lighting, the design, beautiful artwork, it's got such a range of ways of making people feel relaxed, easing their soul, easing their heart. So it's a place that patients love, staff love, and the outcomes are up to it. That's the ethos, and I think we're showing that.